Hi, welcome to Avarion Insights today. Good morning. This is Nancy Ripari. I'm an EVP and partner with Avarion. And Avarion, just for a little bit of history, we've been around for about 18 years. We're a healthcare consulting company. We specialize only in healthcare. And we do advisory services for IT organizations across the country. Here with me today is Barbara Ballard. She is the CIO at Valley Health in Winchester, Virginia. Barbara, turn it over to you to introduce yourself.
Thanks for having us. I just want to give you a little background on Valley Health. We've been working with Avarion for quite some time. We're a regional health system located in Winchester, Virginia, and we have 6 hospitals for critical access, as well as 2 main hospitals in Front Royal, Virginia, as well as Winchester Medical Center. And we've been happy to be a partner with Avarion for a long time and
A
happy
long
to be
time.
here with you, Nancy.
Yeah, it has been a long time. It's been multiple years, and we've done a lot of journeys together through the course of time. Barbara recently, along with key stakeholders at Valley, embarked on an imaging journey that's been both interesting and challenging. The imaging industry has been changing so dramatically over the last several years, and it is a challenge to go through. But I'm going to ask Barbara to kind of walk us through her journey and kind of how it formed and what some of the challenges were that they were facing and where they are today. So, Barbara, we'd love to hear it. I know this is a really interesting topic for people.
Yeah, imaging is an important service line, very important, and we're seeing that as a potential revenue capacity for us in the future from a growth and opportunity standpoint. So when we look across our current partnership, we currently work with a partner in the community as our radiology group. And there's been some challenges with just different integration of their systems, their workflows, our current PACS and cardiology systems as well. And so I've been here about 4 years, and it's always been something that we're working to better and really work together to figure out how to remove complexity with a lot of remote radiologists across the country. As you know, radiologists are not a commodity, they're really specialized. And so we've dealt with issues from our current PAC systems performance to being able to optimize remote radiologist reads and work closely with Winchester Radiology, our partnership, and navigate all those complexities. But that's kind of the background that's driven us to look at how do we really look forward and partner with those radiology groups and optimize for the future and optimize performance because we do see a heavy demand and or revenue stream from our imaging areas.
And as I remember it, you started out with really trying to do some education with your radiologists and your groups through really an RFI process that we assisted you with and helped run for you, really to educate folks on what is in the market today and really how that market has changed and what are the things that they should be looking for. And I think you went into quite a bit of like AI capabilities along with that as well, and some of the more advanced features that were available that I don't think the radiologists maybe had heard about through their groups but hadn't had any exposure to. What did you see as the value of that whole process that you went through?
Yeah, PACS today is really an enterprise imaging platform. It's not just radiology. We're seeing it from the RFI onward. We really defined it to support both radiology and cardiology. As you know, we also have the archive capabilities, but what we saw in the market is not all platforms aren't really built that way, and some are layered solutions. So it's critical for us to select something that could truly support imaging in more of a unified clinical workflow.
Yeah, and I think through that, I believe your radiologists and your teams really had a better understanding of what's out there. What works from a cloud-based solution, the value of on-prem solutions, and kind of the differences between those environments. And you went from there into kind of an evaluation for a period of time, I think internally, and then eventually to an RFP. And so, how many vendors did you send that RFP out to? Do you remember?
We actually sent it to five. We narrowed that down to three. So, through the RFI process, we knew that the biggest issues were performance challenges in too many systems. And so, we have fragmented environments in radiology, cardiology, and storage. And so that really shifted us from looking at just those incremental fixes to really what platform could unify and simplify that rather than adding more layers.
Yeah, and you're starting on your implementation journey now. Actually, let me back up. Have the contracts all been signed, and is the journey ready to kick off?
Well, when we did the RFP, it was a little bit different. We really structured it around AI readiness as well. And so what we did is as we exposed some of those vendors to look at meeting that vision, there were a few that stood out. And when we did find that one that stood out, that single unified platform, obviously there's a premium for that, right? You're not looking at commodity packs anymore. So we really were looking at some non-negotiables around performance, a single platform, both radiology and cardiology, and the ability to scale. So that's really where we ended up during the RFP process. Today, we are still not ink to paper. We are finalizing all of the red lines, but we have negotiated to a best and final offer that we feel is going to support the organization into the future.
And when do you anticipate really trying to get this thing started? And how long will that project go? How long do you anticipate?
So we anticipate to get to signature in the next 2 weeks, and then from there we will be doing, the initial discovery and migration. We are hopefully, if we start by the get everything sealed up in June, we will begin in July, and we anticipate to be live in the early first quarter of 2027.
Yeah, it seems aggressive, but I mean there'll be a lot of work in that. What do you think the hardest things will be during that implementation?
Just making sure that we have a good understanding of change, and get everybody on board for that change and transition, moving from multiple systems to unified platform. Making sure that today that is complex, but we want to get to more of a simplistic deployment to make sure that they're consistently seeing that convergence of those technologies rather than it being that kind of broken processes that they're experiencing today, making sure we can continue to meet performance as we're doing the migration. We still have to continue to have them be productive on the current system as the current system is being migrated. So that's probably the biggest risk as we stand up the new system is the migration and supporting the current existing platforms.
So, Barbara, as I understand it too, you're looking at the solution you picked is cloud-based. Kind of help us understand, your excitement and your concerns either way of moving to the cloud for radiology.
Well, I think it's really looking at performance, right? We evaluated the cloud because of we wanted something that would scale, it would be resilient, and it would support the remote workforce. As I know that, as I said, radiologists are a premium. We're finding more and more radiologists that want to work fully remote from anywhere in the world. And so, in that, we need that resiliency, we need that strong remote capability, and really the cloud platforms, in our opinion, are architected to be that differentiator, especially around remote and performance.
And then will all your historical imaging be pushed to the cloud as well, or is that going to, are you going to keep the VNA that you have, or how is the historical stuff going to be handled?
Yeah, and early on we were, considering that because we still have some investment in the VNA that's expanding farther than this implementation, but we really thought that overall it would not benefit us to try and leave the VNA on premise for us. We're really sticking to a strong retention policy to make sure that we're governing the retention of those images based on our requirements and not based on preferences to reduce the footprint of costs there. And we are planning to move that to the cloud in a single platform. That is part of the migration risk. We do have to migrate that data to the cloud and as well as make sure that the system that it's currently on continues to perform for that period of transition. But we did feel it was an important differentiator to have the full capacity on a platform.
And then you're an Epic organization running Epic today. Did you, when you were looking at the different products, were there differences in terms of the Epic integration or capabilities? I'm just curious, really.
I think our non-negotiables were that we wanted the workflow embedded directly into Epic and into those things. I see that as one of our non-negotiables, and that's also how we ended up with the selection, the single viewer, the embedded workflows, and so that's been an important part of the RFI to RFP process.
Yeah, there's a lot of opportunity there, and are the for the radiologists, are they excited and looking forward to this? Are they and excited for change, or are they a little apprehensive?
Yeah, several years back, I actually partnered with the chair of radiology and we attended RSNA so that we could start to see the emerging technologies and platforms. So even though, our partnership is with with a third party with Winchester Radiology, technically, it's been as if we're all one, right? And so we felt it important to have them evaluating with us, looking at those strong capabilities. We know that they have many preferences, and we are asking them to read more and more and productivity uh, and we know that they've kind of struggled with staffing in those things. So it's been really an important partnership to do it together and not feel like we're doing it in a vacuum and just asking them what they want and then rolling off to make the decision. So they've been along on the when we created the RFI, they were with us as we were going through the RFP. They also have been leaning in with us. What they really haven't been from an operational decision point is, you know, as we've been going through negotiations, if we felt like the solution, the preferred solution, was something that Valley Health could not be a good steward of from an expense standpoint, we told them that we would have to concede on some of the demands if it exceeded, what our board was approving for this investment. And so they've been understanding in that, and so they've not been involved in the negotiations, and that's deliberate because of we've asked them to kind of step back from speaking to the vendors as we go through negotiations to ensure that Valley could control the narrative and get to the best and final offer that Valley Health could support. And hopefully that was on the solution that they preferred.
Yeah, it'll be exciting, I'm sure. They are dealing with a lot of varied technologies today, and so I'm sure they'll be excited once they get over that hump. When with the RFI process, I know we brought in some imaging specialists to really assist in the education part of that, and one of the folks we brought forward was a physician. Did you see value in using that external party to really kind of help guide some of that in terms of helping with that RFP and being able to talk to those radiologists direct?
Oh, yeah. I mean, anytime that you can have a peer-to-peer, expert at the table. In IT, we do the day-to-day support.
Mhm.
Our operational leaders are running the Valley Health instance, they're running the business at Valley Health. But a radiologist to radiologist conversation with requirements and what's in the market and their confidence level and or what they've seen lead to success from that peer credibility standpoint was, I think definitely worth the engagement. And I think it gave them a level of confidence. Because as you know, anytime you're a business partner, you're also looking out for your interest, and having someone that they trust is also in their shoes is was, I think, gave credibility to the process.
You've done a lot of things through the years with the radiology systems and the bolt-ons and things that have been out there. Maybe talk a little bit about that.
Yeah, I think we learned through those experiences that negotiating in terms and requirements and making sure that we have shared understanding of the complexity that we may enter into when we make those decisions was something we evaluated strongly to avoid. And even then, on the current platform and its proposed integrations, we've made sure to build in language that hopefully, if it doesn't meet our expectations, that there's a way for us to exit gracefully. And that's really a lesson learned from past experiences where we didn't really take that into consideration as we were negotiating the complexities of adding different enterprise imaging capabilities to that would work on a scalable platform. And so we're really hoping that through this RFI and RFP process, as well as our contractual negotiations, that we've reduced any risk that exists to Valley Health on that, based on experience of the past.
That's great. I think we'll have to do another follow-up podcast with you after first quarter of next year when it goes
Yeah.
live and see what lessons learned through the implementation and
Oh,
then
I'm sure there will be. But I know that in recent, in the beginning, we had gone into an IntelliRad integration with our existing Fuji Pack system. I don't know if you remember that,
oh, I
Nancy.
do. I do
Um,
very well.
and that was not well thought through. We ended up having to do a breach of contract. Nobody wants to be there. And that's really not only looking at the requirements and building out something that um, you desire, it's also making sure you have all of those risks covered so
Mhm.
that if you start to see anything change, even on delivery and missed milestones and such, that's really what I feel is important about my role in negotiating those final agreements is to make sure there's protections on both sides for what the customer assumptions are on the delivery and what the vendor solutions are guaranteeing because then it's a conversation. It's not a well, how did we get ourselves in this situation, and then how do we get out? So, I think that's part of the value of the process we're talking about.
Barbara, is there any other things that you'd like to add or any other words of wisdom or things that you're going through that are related to this project?
Yeah, AI was a defined requirement of our RFP. And, what we saw is that many solutions rely on bolt-on integrations. And we really wanted to make sure that our platform was compatible with future AI capabilities. So we are working to add a product that's going to be doing rad AI is a potential, and we feel that that's a best of breed. We currently use PowerScribe by Nuance, but this is where we've landed on our negotiation and and believe that that is part of the package that we will be rolling out in addition to, the new PAC solution. And so, we just made sure that AI was a non-negotiable, and that the clinicians were comfortable with what that AI platform is ultimately going to be. And so that was one of the things that I just wanted to add, because I think from a workflow perspective, and being able to optimize the radiologist's work, AI is a must have right now in the industry.
And Barb, I missed it. Did is that a bolt-on product? Is that part of the vendor package you're purchasing from the same vendor, or
Currently, it is a separate package that is
okay?
complementary to the platform that we've landed on, and I think will really be a leader, and was something that the radiologist brought to the table that they felt compelled was a differentiator in the AI market.
Yeah, definitely, definitely. Well, I think it's been this is really good information. I hope people who are listening gain some knowledge out of this and kind of can see the journey that you went through. And certainly, if we can help or you can help, I'm sure people will reach out. But Barbara, great talking to you. Really appreciate the time today. And I wish you well on the rest of your journey with this. But thanks again.
Great. Thanks, Nancy.